Dr. Vercillo, we look at this doctor shortage nationwide. What is your concerns about as we go forward with this? How bad is it?
Well, we know this. We've got an increasing population, we've got an aging population, and so there are a number of reasons that we're going to need more and more doctors as time goes on. Now, there have been efforts to train more doctors, but more than that has to be done. Otherwise, we are facing a potential shortage of physicians. And this is not just primary care. It's mainly primary care, but also the specialties. We're facing a potential shortage of them also.
So, how would you go about addressing that from your point of view?
I think there's a lot that can be done, and in fact, much of this is already being done locally. First of all, we are very fortunate to have a medical school and active residency training programs right here in Syracuse. In addition, you've got University of Rochester, not too far away, and they train doctors and also have residency programs so that they're well prepared to go out and take care of the population. So by having a medical school and residency programs in Syracuse, in Rochester, you've also got Albany. So the upstate area, we've got a lot of people being trained. One thing we need to do, and I know they're already taking action on this, is if you can bring kids in from upstate New York to go to those medical schools, they're much more apt to stay there as opposed to someone who is from New York City or from California or from Texas, so they get trained up here. Many of them are going to go back to their hometowns.
But those other states that you talked about are the states where there's the most critical shortages, or down south in certain areas. They're pulling away a lot of doctors from this area to try to practice there, correct?
You are correct. We are training more doctors than we're retaining in New York State. Now, we train lots of them, and as states go, we've got relatively more doctors per population than most other states do.
Right.
But the distribution isn't always perfect. And I think we could use more physicians upstate New York. So we're doing a lot of things to help with that. First of all, there's a great move to include the local kids when they graduate from college and get them an interview and get them into these medical schools. Nobody's bending the rules or taking unqualified applicants, but there are more applicants than there are spots. And if something could be done to bring these highly qualified individuals who are from upstate New York and get them trained in our medical schools and residency programs, there's an excellent chance that they'll stay here.
One thing that you want to point out that there may also be a way to fill the gaps with mid-level.
Sure. You know, much of what a physician does could actually be done by somebody else if they're adequately trained. And that's what we're talking about with mid-levels. And by that I mean physician assistants, nurse practitioners, nurse anesthetists. And there are a lot of excellent training programs locally for all of these.
Would that require, though, certain types of perhaps even insurance regulations to kind of bend the rules a little bit so that these people can take over certain types of medical care?
You don't really have to bend the rules. Most of them operate or function, I should say, under the supervision of a physician. And in some cases, they're already qualified and empowered to have some independence. Mm-hmm. So the rules are actually pretty good right now. It's just a matter of getting mid-levels trained and out into the communities also. And many already are out there, but they're excellent training programs locally. So you can free up doctors. So if you can bring more doctors in and then free up the doctors to do a little bit more of what physicians are really required for, that'll help. Train people locally, keep them locally. Also, we've got to do things to make our community the most livable community possible. Don't forget, we're competing with San Diego, and we're competing with San Francisco, and we're competing with all these other towns. Now, we can't do anything about our weather, but if we can do things to make our community a very vibrant, desired place to be, and it's not just for the doctor. Don't forget, the physician may well have a spouse or children.
Yeah.
So these have to be places that they want to come to and stay. And if we can get them to come for a few years, they'll like it here and they'll put down roots. The problem is getting them here in the first place.
So would that take maybe some kind of financial attraction? In other words, pay a doctor more than they would get if you moved to California or somewhere else?
I cannot believe there's any doctor that's motivated exclusively by money, but certainly reimbursement doesn't hurt. So there are things going on right now to help in that regard. I can cite a couple of examples. For example, when it comes to primary care, we've got patient-centered medical homes that help free up the doctor to do more of what a doctor does, and it also increases their reimbursement. We've got rewarding physician excellence programs locally to help get more money in the pockets of the doctors. In addition to that, locally we've got a regional health information organization which Excellus, Blue Cross Blue Shield, and others have helped to underwrite so that this will free up the doctors so that they don't have to spend as much time and money with a health information exchange. We will take the burden of a lot of that away from the doctors and the hospitals so that they will have this electronic connectivity and not have to dip into their own pockets for it. Another thing that we do is by being a not-for-profit organization, and in fact most of upstate New York is a not-for-profit area, the hospitals included. What that does is it makes health insurance affordable. And when you have affordable health insurance, and in fact the greater Syracuse area has one of the lowest uninsured rates in the country, it means the doctors and the hospitals don't have that bad debt on their books. They have more paying customers. So all these things are very helpful to attract physicians, and that's just the financial aspect of it.
Does this, should consumers be concerned about this potential doctor shortage along with the Affordable Health Care Act and the fact that a third of doctors are going to be retiring within this decade? Should they be concerned about how all these things are coming together and its impact on the cost of health care?
Well, I think everybody should be concerned in that everybody will do their part to help alleviate that situation. But do I think that it's a crisis, and do I think that there are going to be, dead bodies piling up in the street? No, nothing like that. But certainly it's a significant issue, and we have enough lead time on this that we can do something about it. There are other things that can be done in New York State to attract good, qualified people. For example, perhaps a change in some of the liability laws to make it more like California. We'd be able to attract more physicians locally. That's something that I think most doctors would be very amenable to. So there are scholarships that Excellus and others are contributing to bring our local youth into the medical school here locally. And in fact, there's been a recent example of success in Oswego. Just yesterday there was an event held where they welcomed 13 new doctors, some in primary care, some in a variety of specialties, but to Oswego County. Now that's not on most graduates' lists of places to go when you graduate from Vanderbilt or Boston College. They probably have never heard of Oswego. But there are things we can do to show the attractiveness of our communities in upstate New York. You look at the Finger Lakes, you look at the Adirondacks, look at Thousand Islands. There's so much we have to offer in terms of natural beauty. Yes. And these are things that, it's not bad to have that snow. People like to ski and snowmobile. There are a lot of attractive things. It's a great area to raise your kids. We have to get that message out there so that when somebody goes to Cornell and they're in Ithaca and then they go to upstate for their medical training, that they stay in this community.